Welcome to this clinical overview of Alzheimer's disease, where we will explore the pathophysiology, stages, and modern therapeutic strategies. We begin with an introduction to Alzheimer's, aiming to understand the growing public health crisis it represents. The number of individuals living with Alzheimer's disease is expanding rapidly. Projections show the figure reaching 13.8 million by 2060, placing unprecedented strain on global healthcare systems. Alzheimer's is the most common cause of dementia. This irreversible neurodegenerative disorder is characterized by the progressive death of brain cells and synapses, leading to a gradual loss of cognitive function. Next, we will delve into the brain changes associated with Alzheimer's, covering both macroscopic and microscopic pathology. Macroscopic changes include cerebral atrophy, where the brain cortex shrinks significantly, and ventricular enlargement, where fluid-filled spaces grow larger to fill the void. Microscopic hallmarks are amyloid plaques and tau tangles. Their combination leads to synaptic loss, resulting in cell death and network failure in the brain. The disease continuum moves from preclinical AD through mild cognitive impairment to mild/moderate AD, and finally to severe AD, each stage marked by distinct changes. Preclinical Alzheimer's is considered the silent phase of the disease, occurring many years before symptoms are noticeable. During preclinical AD, amyloid and tau pathology accumulate silently, but cognitive function remains normal. This early window is the focus for preventative clinical trials. Mild cognitive impairment is a critical juncture where memory changes are noticeable to the patient, but do not yet impair independent daily life. Mild Alzheimer's disease presents with symptoms like frequent memory loss, disorientation, difficulty with executive function, and mood changes such as increased anxiety or irritability. Moderate Alzheimer's is characterized by deepening amnesia, difficulty recognizing family, loss of adaptability, and increased dependence for daily tasks like dressing and bathing. In severe Alzheimer's disease, patients experience loss of communication, environmental unawareness, and severe physical decline. This stage requires full-time, round-the-clock personal care. The burden on caregivers is immense, with nearly 13 million Americans providing unpaid care. Almost 60% of these caregivers report high to very high emotional stress. Now we shift our focus to the diagnosis and management of Alzheimer's disease, exploring the evolving strategies and therapeutics. Modern diagnostic tools include cognitive testing, such as the MMSE and MoCA, which remain foundational for tracking decline. Blood biomarkers like PTAU-217 are revolutionizing early detection, and neuroimaging confirms underlying pathology and rules out other structural causes. Current standard treatments target symptoms with drug classes like cholinesterase inhibitors, glutamate regulators, and orexin receptor antagonists. Anti-amyloid antibodies are now available to address disease progression,